genital organs. The external genital organs are the scrotum and the penis. So let's look at the scrotum first. Okay, scrotum is a sac that contains, what does it contain? Testes and also
Epididymis.
but also spermatic cord, let's say,
Alright.
spermatic cord. Okay, the whole thing is the scrotum. Not only this part, this whole thing is the scrotum. So basically, so we have the testes and also the lower part of the spermatic cord. So lower part of the spermatic cord and testes are located in the scrotum. And we know that the scrotum is coming from the superficial inguinal ring, and superficial inguinal ring is formed by
The
External abdominal oblique.
the upper nerves of the external oblique muscle. External oblique muscle, yeah, the upper nerves of the external oblique muscle. And that basically it continues with, when you go backwards, with the inguinal canal, and inguinal canal opens to the
deep
deep inguinal ring to the peritoneal cavity, to the peritoneal cavity. Okay. So inside the spermatic cord, we have a lot of structures. We talked about this. 1, vas deferens. 2, testicular artery. 3, testicular vein. It's testicular vein, but when it comes into the testes, we call it pampiniform plexus. Why? Because they have a lot of branching. Okay, there's like anastomosis of the vein. That's why it's referred to pampiniform plexus. What else?
Nerve bundles.
Genital branch of genitofemoral nerve and
Cavernous.
ilioinguinal nerve.
We
Okay,
also have
and then sympathetics.
the cremaster.
Yeah, we
Master.
didn't say cremas. That's important. Yeah, cremasteric muscle or cremaster muscle, and fascia along with it. And then, so this is the spermatic cord here. Okay, and so basically the layers of the spermatic cord and the layers of the scrotum would be first from outer part towards the inner. So we would find what the skin,
Skin, dartus fascia.
dartus fascia,
External
external
spermatic fascia.
cremasteric muscle and fascia,
Internal spermatic fascia.
cremasteric fascia. Okay.
Tunica vaginalis.
Right, and then we have the tunica vaginalis, or the vaginal process, the most inner aspect. The vaginal process, tunica vaginalis, is composed of 2 layers,
Parietal visceral.
the parietal and visceral. So basically, so we have, this is the skin here, okay? And the next layer is what? Okay, so this is the skin, the fatty tissue, the yellow part. And then we see this red. This is what? The muscle. Cremasteric. The cremasteric.
Dartus or cremaster?
Okay, this is cremasteric here. Okay. This is the cremasteric muscle and cremasteric fascia. Remember, it has like fibrous type. Okay, so this is the mid part. Above that, we have the external fascia. So this is the mid layer. Cremasteric fascia and muscle is the mid layer, and beneath that is the internal what?
Internal spermatic fascia.
Internal spermatic fascia. Internal spermatic fascia is continuous over the transverse fascia, not internal. Okay, so
Internal is external.
right. So internal upper nerves does not have a continuation there. So the internal spermatic fascia is a continuation of the transversalis fascia of the anterior abdominal wall. And these are the structures that are located inside this spermatic cord. So we have these arteries and veins and nerves. Okay, this is the testes here. This is the epididymis. Testes and epididymis. And in testes, that's about it here. So again, let's look at over here. Again, we have the spermatic cord, pampiniform plexus, and along with that we have testicular artery. You see, so this is the inner part, and then we have this. This is the internal spermatic fascia, this white, and above that we have this.
Muscle.
This red is the muscle, is this cremaster muscle, and above that is the external spermatic fascia. Okay, here. this is epididymis. We have the head, body, and tail of the epididymis. Head, body, and tail. And that's about it for the testes. Nothing special about the testes, right? You have this. What do you have there? Seminiferous tubules, and then we have the spermatogenic cells inside this seminiferous tubules. And so we have one testis on the right side, and so we have this is testicles, one testicle on the right and another testicle on the left side. Separating these two from each other is the
Perineum.
median septum. Median septum.
Okay.
And median raphe, yes, right, median raphe. Median septum is like it's mostly located inside, but median raphe is on the outside. But median septum is the connective tissue that separates the two testicles. So what happens then? So the sperm passes through the epididymis, right? And that epididymis connects with the vas deferens. It goes up, so it's a muscular wall. It has a muscular wall, vas deferens. It goes through inside the spermatocord through the superficial ring, and then canal, and then comes out through the deep inguinal ring here, along on the lateral side of the urinary bladder. It crosses here the urethra. You can see it? So urethra. It crosses here of the urethra, right? And from here, so basically here at this level, it's very close with the seminal vesicle, or seminal gland, so seminal vesicle. And this will go over here at the back. Can you see it? Okay, so this is the vas deferens. This is the ureter. Okay, it crosses the ureter, and then comes back at the back on the base of the urinary bladder. It enlarges and it forms ampulla. Right. So this is the ampulla. So this is the. So this is the ampulla here. Enlargement. I mean, can you compare them? So one is narrow before that, and then enlarges. It forms the ampulla. Ampulla connects the ampulla of the vas deferens connects with the duct of the seminal vesicle, forming
Ejaculatory
duct. Okay. So these two come together. They form ejaculatory duct. Here, this is the ejaculatory duct. It opens to the prostatic urethra. Okay. Where does it open to in prostatic urethra?
Seminal colliculus.
Right. So we have the seminal colliculus. So we have seminal colliculus. It's a bulging mucosal fold. So we have seminal colliculus. On either side we have two holes opening, ejaculatory duct, and we also have a structure in the middle. That middle structure is called
The urethral crest.
prostatic utricle, right? It's over here. So this is the prostate here. Okay, this is the bladder. It's the internal urethral orifice. It opens to the prostatic urethra. So in the prostatic urethra, you see this bulging, enlarged tissue. That is called the seminal colliculus. Seminal colliculus is important for us. Why? Because we have two openings on either side, ejaculatory duct. In the middle, it's not an opening. Okay, it's just a structure that is located there, and that is called the prostatic utricle. And it's the remnant of what?
Homologous
Paramesonephric duct. Okay, and paramesonephric duct is primarily concerned in the differentiation of the female genitalia. Okay, so since this is a male, so that duct is like non-functional. So it's a non-functional structure, the prostatic utricle. And that's about. This is the sinus, the prostatic sinus. Inside the prostatic sinus.
Prostatic ducts.
So prostatic ducts. So we have many ducts of the prostate gland opens to that area. So that's about it. So this is the prostatic urethra. That's the prostate. And so, and then you have the membranous urethra. We talked about this, right? Yesterday, we have the membranous urethra over here. Membranous urethra is, where is it located primarily? It's located in at the area of urogenital diaphragm, and that's the area where you have what? What do you have there in your urethra?
External sphincter.
Right, external urethral sphincter. No, the internal urethral sphincter or external?
External.
External urethral. Where's the internal?
Upper.
in the
Before the
next one.
prostate.
Right. So internal urethral sphincter is over
Neck
here.
of the-
Okay, where the bladder is. That's the internal urethral sphincter. So external urethral sphincter is after it passes the prostate, which is where you have the urogenital diaphragm. Okay, urogenital diaphragm, and that's the part of the levator ani muscle. That's why. So that, and then after that we have the penile. When you have the penile urethra, okay, which is located here. So that's that. So let's look at the. So after that, it basically goes out. We're talking about the ejection of the semen. Ejection of the semen. So let's look at the penis now. Okay, so again, penis is not that difficult. Okay, this is the cross section. We have the root. By the way, what we see here is this ligament here. Okay, this is symphysis pubis, right?
Mm-hmm.
That this ligament that connects the penis to the symphysis pubis is what?
Suspensory ligament.
Right, the suspensory ligament. Okay. And this ligament here that connects to the linea alba, fundiform, right? So this is the fundiform ligament, and this is the suspensory ligament of the penis. It connects to the symphysis pubis. Okay. So this is the root part, the immobile part of the penis, and this is the mobile part, the body, and then we have the glans, penis. Corona, glans, penis, corona of the pubis, and then we have the frenulum at the back here on the ventral side, frenulum of Prebius. Okay, basically the skin that connects the body, it attaches the body to the glans, the frenulum. So this here is the frenulum, and then we have 3 erectile tissues, 2 on the dorsal side, 1 on the ventral. So this is basically. So this is the dorsal side of the penis. This is the ventral side of the penis. Okay. So we have 2 on the dorsal and 1 on the ventral. The 2 dorsal is what?
Corpus cavernosum.
Corpus cavernosum, penis, and then the ventral one is
Corpus
corpus spongiosum. Corpus spongiosum important. Why? It
Urethra
contains
has-
the urethra.
Urethra.
It contains the urethra. Okay. So if we have a cross section, so these are 2 corpus cavernosum penis, and we have corpus spongiosum penis, and you have the urethra passing through the corpus spongiosum. And there's an enlargement in the glans plenis in the urethra as it passes through the glans plenis. We call them the navicular fossa. Okay, so it's a little bit enlarged. So the most restricted and the narrowest part is external urethral orifice, which is this when it goes out. So you would expect the maybe if there's a stones that are accumulated from the kidney stones, if it goes out, it might get stuck over here, okay, too, because this is it, or it might get stuck in the which part of the urethra? Membranous part of the urethra. So you have to drink excess amount of water so you can push the galls, the stone, the kidney stones, out. Okay, so that's that.